So this is a slump test. Slump test could be for disc herniation or sciatica. So we're going to be really stretching that neural pathway. I want the client's hands behind the back. 4 steps to this test. So the first one, I want the thoracic area to be flexed. Just look up for me. You keep looking up and I want you to slump your back. That's it, good. So that's step 1. Step 2, bring your chin down to your chest. Very good. Step 3, we want to straighten the leg. And step 4, we're going to bring the toes towards. And in that position, the sciatic nerve into the spinal cord all the way up the back is in a really stretched position. Just relax for me. Now, did you feel pain anywhere at that point?
No.
No. A positive, let's go through those steps again. So I want you to look forward and slump. Bring your chin down. So if a client is feeling pain here, it's more severe than feeling it right at the end of that movement because they've only stretched it a small amount. If they feel pain here, get them to lift their chin up, okay, and don't go any further with the test. However, we're going to go chin down, knee extension. If they feel pain now, maybe into the leg, into the foot, take them to go into knee flexion this way, and that would reduce the pain. So for each movement, it would increase the stretch, which would increase those neural symptoms. So this test is called the straight leg raise or the SLR test. For this one, it's a passive test. So I'm going to take my client's leg here and just take them into hip flexion. At any point they feel pain, they're going to let me know. Okay, you can see my client is quite flexible and no pain at any point in that. Now, a client with pain within the first 30 degrees of hip flexion, so around this area here, it could indicate a condition called Spondylolisthesis. Try and spell that one. And that is where the lumbar vertebra shift. So as you're lifting the leg up and the hips rotate slightly, it's the shift forward of the lumbar vertebra. As we go past 30 degrees and we're going 30 to 70 degrees, they may start to feel some pain, maybe coming down into the leg. So that can indicate sciatica. Sciatica can be caused through disc problem, slip disc, or through piriformis syndrome. So we can differentiate between the two. So let's say they felt some pain going into their leg in this position. If I take them into lateral rotation, what that's doing is it's shortening the piriformis muscle. So if the symptoms decrease and the pain goes, it could suggest it's the piriformis muscle is tight. If I take them into medial rotation and the pain increases, that's stretching the piriformis, and therefore it tells us it could be the piriformis muscle as opposed to being a disc issue for sciatica. If I take them further than 70 and they're getting pain, normally it's tightness in the hamstring, but pain in this area could indicate a hip issue. We call it hip pathology. It doesn't tell us what's the problem, but the condition is around the hip area.